Chapter 10, Part 2, Radiation Dose in CT. Several factors affect dose in CT, but they usually fall into one of two categories: those that have a direct effect on dose and those that have an indirect effect on dose. We're only going to discuss the factors that have a direct effect on dose in this chapter, and these include exposure factors, X-ray beam collimation, pitch, patient centering, number of detectors, and overranging. Exposure technique factors are characterized by tube potential and defined by kilovoltage. The tube current is defined by milliamperage, and exposure time is characterized by milliamperage seconds, or mass. The tech can select these factors manually, or they can be selected by AEC, which uses the automatic tube current modulation that we will discuss a few slides later. Constant mass is a selection of milliamperage and time in seconds separately, or mass on some scanners before the scan begins, but all other factors are kept the same. Mass determines the quantity of photons, or the dose, on the patient for the duration of the exposure. And remember that the dose is directly proportional to the mass. So if the mass is doubled, then the dose is doubled. Effective mass is the term used for multi-slice CT scanners that denotes mass per slice. And it uses the formula true mass divided by pitch equals effective mass. So basically, in order to keep the effective mass constant, as the pitch increases, the true mass must be increased as well. So for example, increasing the pitch from 1 to 2 then increases the mass per rotation from 100 to 200, while the relative CTDI volume stays the same. Peak kilovoltage determines the penetrating power of the photons coming from the X-ray tube. The higher the kVp means the photons have higher energies and can then penetrate the thicker objects compared with the lower kVp X-ray beams. The high kVp techniques are used in adult CT imaging. It's usually around 120 kVp, and the radiation dose is proportional to the square of the kVp. Collimation is used to define beam width for the exam. So it's different between single slice and multi-slice scanners. And pitch is common to just spiral or helical scanners and depends on the manufacturer of the scanner. Pitch is the ratio of distance that the table travels per rotation to the total collimated X-ray beam width. There is an indirect relationship between dose and pitch. So as the pitch increases, the dose decreases, as long as all the other factors remain constant. So, for example, if pitch is increased by 2, the dose is decreased by 1/2. The number of detectors is measured radiation dose, and it is inversely proportional to the number of detector rows. So as the number of detector rows increases from 4 to 8 to 16, then the dose decreases with both standard and the near identical technique. Overranging, also known as overscanning, is when additional rotations before and after the planned length of scan are necessary for image reconstruction in order to image a specific area of interest. And overranging increases the dose to the patient. With patient centering, the patient must be centered isocenter in the gantry for accurate imaging. Incorrect patient centering degrades the image quality and also increases noise, and this increases dose to the patient as well. The use of bow tie filters in CT shapes the beam intensity with the in-scan field of view. It also produces a more uniform beam at the detectors. So because the X-ray beam is filtered, then the bow tie filters actually play a role in decreasing the dose to the patient, since the low energy photons are removed, which then therefore makes the beam become harder. Automatic tube current modulation optimizes dose to the patient while maintaining a constant image quality, regardless of the size of the patient in the z-axis and the attenuation changes in the xy axis. It's been said that automatic tube current modulation is actually the most important technique for maintaining a constant image quality while optimizing the radiation dose. The overall goal of automatic tube current modulation is to provide a constant image quality despite the patient's size and the tissue attenuation differences, and to control the dose in the patient, especially when compared with the manual MA selection techniques. We will discuss angular modulation, which is automatic control of the tube current in the XY axis, also known as the end plane. Angular tube current modulation is based on the fact that attenuation varies from the AP projections to the lateral projections as the tube rotates around the patient. Although the high attenuation projections will require higher MA values, the low attenuation projections will require low MA values. The XY axis tube current modulation ensures a constant uniform noise level is maintained during the whole scanning process. Longitudinal, also known as Z-axis, tube current modulation is the automatic change in tube current in the Z-axis, or the through plane. And this is based on the difference in attenuation of the body parts. So, for example, the thicker body parts like the abdomen and pelvis will attenuate the radiation more than the thinner body parts like the head, neck, and chest regions. The Z-axis tube current modulation changes the MA automatically as the patient is scanned from head to toe while maintaining a constant noise level for the different body part thicknesses. This picture just shows a few examples of the tube current modulation. So A and B show a varying tube current, or MA, regarding different patient sizes. And you can see that lower MA is needed because this is a smaller or a thinner patient as compared to image B here. So, and then take a look at image C. So this just shows that it's an example of Z-axis modulation where the chest is thinner than the belly or the abdomen and pelvis. So the chest actually has a lower MA than the belly, which has a higher MA. And then image D over here shows angular tube current modulation. And it just shows that when the x-rays are being passed laterally through the patient, it requires a higher MA because it is thicker as compared to the AP projections, which require a lower MA since they are thinner. So some things to keep in mind if you are operating the CT regarding image quality and dose is, first of all, that to reduce the noise by a factor of 2, you must increase the dose by a factor of 4. To improve spatial resolution or pixel size by a factor of 2, while keeping the noise constant, you need to increase the dose by a factor of 8. To decrease the slice thickness and the pixel size by a factor of 2, then you need to increase the dose by a factor of 16. And also, increasing the MA and KVP increase the dose proportionally. So as you kick up that MA or kick up that KVP, it does increase the overall dose to the patient. Dose optimization strategies have been created to help CT users reduce the dose to the patient while also maintaining optimal image quality. Dose optimization is a radiation protection principle that is intended to ensure doses delivered to patients are kept as low as reasonably achievable. Essentially, the principle of optimization refers to reducing radiation dose while maintaining the required image quality necessary for the RADs to make a diagnosis. And dose optimization has actually been getting increased attention in regards to pediatric CT imaging especially. It is important that the RAD ensures that all exams ordered should be justified and that the need for communications between the ordering physicians and the radiologist is crucial in the process of the CT dose reduction. There are 4 important requirements for dose and image quality optimization that we will discuss. The first is to ensure patient safety. The second is to determine the level of image quality required for the task. Third is to acquire the images at various exposure levels from high to low so accurate diagnosis can be made. And fourth is to use reliable and valid methodologies for dosimetry, image acquisition, and evaluation of image quality using human observers. In order to accomplish the 4 requirements we just went over, CT dose and image quality optimization studies must ensure that the following minimum essential elements are considered. First, you need to consider that the CT scanner is calibrated to ensure consistent and reliable performance. Second, you need to consider that the dosimeters used to capture the dose levels are calibrated. Third, that researchers use appropriate phantoms and acceptable dose measurement methodologies of acquiring scans at different exposure levels are used. And the fourth is to consider that images are assessed in 2 phases. That number 1, the observers evaluate the image quality based on the criteria to establish an optimized dose level, and number 2, that the observers evaluate images obtained at various dose levels. So far, we have discussed how important it is to reduce dose to the patient, but it is also important to reduce dose to the medical personnel, such as the techs. Radiation protection practices include the use of time, shielding, and distance to protect both the patients and the personnel. For time, it is important for personnel to minimize the time spent in the CT scan room during exposure. For distance, the dose is inversely proportional to the square of the distance. So the further away someone is from the radiation source, then the less dose that they receive. The technologist should stand as far back as possible from the patient in the CT room, since the patient is the main source of scatter radiation. This is why a power injector is used from inside the control room for some exams. Shielding protects not just the patients, but the personnel as well. The shields can be used to protect eyes, gonadal regions, breast, and thyroid regions to protect significant dose reduction to these respective organs. Lead aprons should be worn when personnel must stay in the scan room during the patient's scan, and this is due to the presence of scatter radiation. The walls of the CT room should also be lead lined to protect the public from scatter radiation as well. Radiation protection principles deal with justification, optimization, and dose limitation principles that are crucial to radiation protection regulations. Regarding justification, this involves the concept of the net benefit. So there must be a benefit associated with every single exposure. The requirement is intended for referring physicians in an effort to reduce dose to the patient undergoing the exams that they order. For optimization, it is intended to ensure that the doses delivered to the patients are kept as low as reasonably achievable, with the economic and social factors taken into account. In implementing ALARA, techs should always apply all relevant technical radiation protection principles to ensure that the dose is optimized and that the image quality is not compromised. The concept of dose limitation addresses the dose that an individual receives annually or accumulates over a working lifetime. These doses should be within the established limits, and they are recommended in order to reduce the probability of stochastic effects and to prevent the detrimental deterministic effects of radiation. So I'm sure you've all heard of these 2 organizations. Image Wisely and Image Gently are 2 website resources that provide essential elements of radiation safety in adult and pediatric imaging. Image Wisely was formed by the American College of Radiology and the Radiological Society of North America, and it addresses the concerns about the surge of public exposure to ionizing radiation from medical imaging. The objective is to lower the amount of radiation used in medically necessary imaging studies and to eliminate unnecessary procedures. Image Gently is the Alliance for Radiation Safety on Pediatric Imaging, and their mission is to improve the safety and effectiveness on the imaging care of children worldwide. So this is achieved through increased awareness, education, and advocacy on the need for appropriate examination and the amount of radiation dose when imaging children.